Hi, I'm Angela Dubinsky. I'm a pelvic floor physical therapist at a clinic in Austin, Texas called Sullivan Physical Therapy. And one of the diagnoses that we commonly treat here is interstitial cystitis. So I wanted to talk a little bit about some of the symptoms that patients with IC come in stating that they have, and then some of the common physical therapy treatments for IC. So as far as the symptoms go, patients will often complain of pain in the abdominal region, pain in the suprapubic region, as well as pain in the bladder. They'll say that they have burning with urination, increased urinary frequency and urgency, as well as pain during sex. Now, physical therapy treatment varies depending on the patient, as well as depending on the severity of the symptoms. But I wanted to provide you with just some examples of interventions that have been found beneficial for patients with IC. So the first is manual treatment. What manual treatment is any type of hands-on treatment externally and or internally to help release some of the tension in the muscles that may be contributing to your symptoms. This may include myofascial release, trigger point release, and connective tissue manipulation. And the next intervention is therapeutic exercise. Again, this ranges, but it can include postural re-education, stretching exercises, going over different relaxation techniques, as well as strengthening exercises sometimes. Behavioral modification is another thing that your physical therapist will help you with, and what this means is that a lot of times with interstitial cystitis there's what's called triggers, and a trigger is anything within the environment that causes you to have a flare in your symptom. A lot of times this is diet related. So your physical therapist will work with you, try and help you figure out what these are, and then help you make modifications within your lifestyle to decrease the symptoms of these triggers. And then the last thing, there's a couple of other modalities that you might see or read about: electrical stimulation and biofeedback. Both of these can be helpful as well. So this is just kind of a brief overview, but again, it really depends on the patient and the severity of the symptoms. But the interventions that I've just talked about have been found beneficial in patients with IC. Thank you.